Our briefing. Let's listen in.
The country is not getting any better. I'm sure we are all aware that we are currently experiencing a second spike. There are certain counties where we have witnessed a steady increase in the number of cases in the past 5 weeks. These counties include Kajiado, Kisumu, Kitui, Machakos, Meru, and Nyeri. Majority of the confirmed cases in these counties are in communities. Nairobi continues to lead in the number of confirmed positive cases, with a steady increase in the past 2 months. Mombasa County has also seen a steady increase in the past 2 months. Our medical experts are attributing the rising number of cases in all of these counties to the flagrant abuse and flouting of the containment measures we have issued here at the Ministry of Health to combat this deadly virus. This indeed is not a good sign. If we have to fight this war, we must deploy all the ammunition at our disposal to defend ourselves, our children, our elderly parents, as well as secure a future generation. For this reason, fellow Kenyans, as we have always stated here since the pandemic struck our country in March this year, we shall not get tired of reminding you to strictly adhere to the containment measures as our first line of defense against the virus. These measures include regularly washing of hands with soap and running water, wearing of face masks at all times in public places, maintaining social and physical distance, and avoiding all forms of gatherings, whether social, religious, or political. A lot of infections have been witnessed in places of worship, at weddings, as well as at funerals. In view of this, last week, the Interreligious Council announced new measures to be followed at places of worship, as well as in funerals and weddings. Just for the record, according to the Council, those physically attending services in places of worship will be determined by the social distancing possibilities and the size of space available. The services are not to exceed more than 90 minutes, down from the earlier 2 hours, while the age limit of those attending is over 6 years and below 65 years. On funerals, the Council determined that the number of people to attend has been limited to 100, and only 15 close members of the deceased are to be allowed at the gravesite, family members. The duration of the burial must not exceed 1 hour, and no food is to be served at funerals. On the other hand, at weddings, the Council determined that strictly only 50 people are to attend. No food is to be served except to the close family members. We want to make a special appeal to all Kenyans to strictly follow these measures as a way of fighting any more infections. Yesterday, the National Emergency Response Committee on Coronavirus, under the chairmanship of CS Mutahi Kagwe, held a meeting to, among other things, review the current situation of the disease in the country. The meeting was also attended by His Excellency the President, Uhuru Kenyatta, who made a surprise appearance. The meeting noted the increasing significance of a viable vaccine in the containment of the spread of COVID-19 and resolved that the committee should expand its mandate to cover matters related to efforts towards securing such a vaccine when it becomes available. Our research institution, the Kemri Wellcome Trust, also provided an update on the ongoing research between the institution, AstraZeneca, and Oxford University. And as you are aware, this is what is called the ChAdOx vaccine, in which Kenya is participating in this trial, among other 7 countries, which include the UK, Brazil, South Africa, Japan, USA, and India. It is expected that across all these countries, this particular vaccine trial will engage 60,000 participants before the end of the year. While Kemri continues to collaborate with AstraZeneca and Oxford University in the trials for this vaccine, the government remains open to other collaborative opportunities in this area of vaccines. In this regard, the meeting resolved that Kemri will continue to collaborate with researchers from other countries such as South Korea, India, Singapore, and China, among others. Today we are also marking the World AIDS Day. I want to point out some key highlights for this day in our country. Number one, over 96% of people who know their HIV positive status are on life-saving treatment. More than 90% of those on treatment have controlled the HIV virus and therefore pose a very low risk of HIV transmission. This is further evidenced by the decrease of new HIV infections to less than 36,000 in 2018, a stark reduction from 106,000 that we recorded in 2012. So we have made tremendous progress between that period of time. With these notable outcomes, Kenya is well on its way to achieving epidemic control. Secondly, today in Kenya, over 1.1 million people are benefiting from antiretroviral treatment. A remarkable achievement and a testimony to the strength and resilience of our HIV program. This progress is attributed to many factors, primarily among them an excellent partnership with bilateral and multilateral agencies, a multi-sectoral response with a strong health sector leadership and strong political commitment. Thirdly, the COVID-19 pandemic poses a challenge to the uptake of HIV testing services due to low outpatient hospital visits during this period. The uptake of HIV testing services has declined over the months between January 2019 and June 2020, with the lowest uptake noted between March and April, where testing volumes reduced by 33%. Antenatal clinic attendance and testing were not impacted. There has also been an upward trend in the number of clients newly enrolled on antiretroviral treatment between January 2018 and July 2019, with a subsequent decline up to June 2020. The adult cascades for the 1990-90 targets indicate that 83% of adults that are HIV positive have been identified. 87% of these are enrolled in care, and 97% have achieved viral load suppression compared to the pediatric cascade. We look at the pediatric cascade on these 90-90-90 targets. In children, 63% of HIV positive children have been identified. 72% of these are enrolled in care, and 83% have achieved viral load suppression. So we are below the 90-90-90 target for children, and I think that is an area that our program is now focusing on, moving towards those targets. In terms of age, sex distribution, no COVID-19 effects were noted as the proportion of males and females across the various age groups remained the same during this pandemic period from March 2020 and June 2020 data when they are compared. Given the observations relating to HIV during the pandemic, the Ministry of Health wishes to encourage patients and any person wishing to seek services not to shy away from doing so. Let COVID-19 not be an excuse for failing to visit health facilities. Let us turn now to our COVID situation. Today, 551 people have tested positive for the virus, following testing of a sample size of 4,675 over the past 24 hours. This brings to 84,169 the number of confirmed positive cases in the country. From the 525 positive cases for today, from the 551 positive cases today, 525 are Kenyans and 26 are foreigners. In terms of gender distribution, 301 are male, 250 are female. The youngest is a 7-day-old infant. The oldest is 100 years old. Distribution of cases by counties is as follows. Nairobi leads with 212 cases, Kilifi with 39, Mombasa 35, Nyeri 33, Embu 30, Nandi 25, Machakos 22, Siaya 21, Kajiado 19, Kiambu 18, Lamu 16, Nyandarua 14, Turkana 11, Taita Taveta 7, Kisumu 7, Meru 6, Uasin Gishu 8, Garissa 6, Kwale 5, Samburu 5, Muranga 3, Mandera 2, Nakuru 2, Busia, Laikipia, Kakamega, Wajir, and Tharaka Nithi 1 each. If we look at Nairobi, with the highest number of 212 cases, these come from Kibra 62, Langata 32, Westlands 30, Dagoretti North 14, Starehe 9, Embakasi South and Makadara 8 cases each, Embakasi West, Kamkunji and Ruaraka 7 cases each, Dagoretti South, Embakasi Central and Kasarani 5 cases each, Mathare 4, Embakasi East, Embakasi North and Roysambu 3 cases each. The 39 cases from Kilifi are from Kaloleni 20, Kilifi North 17 and Malindi 2. Mombasa's 35 cases are from Likoni and Vita, 11 cases each, Nyali 6, Kisauni 4 and Jomvu 3. The rest of the distribution by sub-counties is in the document that you shall receive. On a positive note, today 266 patients have recovered from the disease. 206 of them from the home-based care program, and 60 discharged from various hospitals. The total recoveries now stand at 18,146. We want to thank our healthcare workers for this achievement and the good work that they're carrying out there. At the same time, sadly, we have lost another 5 patients to the disease, bringing our total fatality to 1,474. Again, our sincere condolences to the families and friends of those who have lost their loved ones. There are 1,275 patients admitted in various health facilities countrywide, while 8,070 are on home-based care, isolation and care. 71 patients are in the intensive care unit, 36 of whom are on ventilatory support, and 34 on supplemental oxygen. Another 88 patients are separately on supplementary oxygen, out of whom 70 are in the general wards and 18 in the high dependency unit. Thank you. And we'll be ready to take a few questions, if you have any.
Good afternoon, Daktari. My name is Alphas Lagat from Citizen TV, and my question is just about, it's about 6 days to the announced strike by the doctors countrywide, clinical officers as well as nurses, saying that their plight has never been addressed. How and when do you plan to reach a consensus to avert this crisis? The second question is about KEMSA. About 3 weeks ago, the CS announced that he had written a letter to KEMSA allowing them to sell the PPEs at the current market prices. Today, the Senate Health Committee has been there and they've realized that none of the PPEs have been sold from that duration where they were allowed to sell the PPEs, and only about equipment worth 2 billion shillings have been sold, meaning about 5 billion worth of PPEs is still lying at KEMSA, and also remembering that there's a timeline of about 2 years before the PPEs are considered of low quality. How do you intend, or what is happening at KEMSA? What is the true state of affairs in KEMSA? Thank you.
Helen Aura from NTV. You mentioned 1.1 million Kenyans are benefiting from ARVs at the moment, and other than the low testing turnout that we're experiencing during this time, has the pandemic affected the availability of ARVs to those who are infected with HIV? My second question is, with schools set to reopen in January, the ministry said they're partnering with the Ministry of Health, stated that they're partnering with the Ministry of Education to ensure that there's enough and sufficient training in the case of a surge when schools reopen. How far are we with the set training? Because I remember the CS had mentioned the same case when he was before the Senate. My last question is regarding the trial vaccines. KEMRI had identified case studies to start this testing of the vaccines. Maybe this information you can be able to give us more, and we see like how, if indeed they've already started out with the trials and testing, how far are we right now? Are we on a good note, or did they have side effects or anything? Thank you.
Nancy Okware kutoka KBC. Swali langu linawiana na alilouliza Aura kuhusiana na chanjo, na hapo jana Moderna ilituma ombi kwa Marekani iruhusiwe kufanyia majaribio ama kuanza matumizi ya chanjo yake, na hivyo basi huku Kenya vilevile tulisema ya kwamba bado tunasubiri kuidhinishwa kuhakikisha kwamba chanjo yenyewe bila shaka haina madhara, na tumeshuhudia taarifa kwamba kunao mataifa ambayo tayari yameagiza ile chanjo ile ya Moderna na vilevile Pfizer. Kama Kenya ni kipi ambacho tunafanya kuhakikisha kwamba ikiwa chanjo yenyewe itaidhinishwa na shirika la afya duniani, basi hatutakuwa tumesalia nyuma? Asante.
Hi, my name is Graham Kajilo from The Standard. From the breakdown of the numbers that you've given, There are some 56,479 patients who are not captured anywhere. So they're not in hospital, they're not dead, they're not recovered. What is the update of contact tracing? And also, there was a time the DG mentioned about the number of deaths. That some of the high numbers that you were reporting was a result of an audit. I would like to get some more information on that audit. Are there also deaths that were not necessarily COVID that you also, at the end of the day, ruled out?
Okay, thank you. There are quite a number of questions here. I will answer some, and I will hand over to the DG to answer some of them as well. Elfas Lagat, your question was regarding the strike, the notice that the healthcare workers have issued. Of course, the Kenya Medical Practitioners and Dentists Union issued a strike notice. The umbrella organizations of the other healthcare workers equally have vowed to go on strike. What I can tell you is that this matter is actually receiving a great deal of attention at various levels. Just last week, the Kenya Medical Practitioners and Dentists Union and a number of government agencies appeared before the Health Committee, the National Assembly Health Committee, to dialogue on the grievances that they are raising and how we can move forward. And some level of progress has been made at that meeting. Tomorrow we will be again meeting with the Ministry of Labour on this matter of the strike. So as far as the government is concerned, we are engaging the healthcare workers and their unions, and we would want to avert this strike because this is not something we need at this point in time.
Right, the very latest there regarding our COVID-19 situation, 551 new positive COVID-19 cases from a sample size of 4